Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, the topic is masks. Are we wearing the right ones? Should we toss our cloth masks? How do we create better masks for future pandemics? How do we shore up the supply chain? Stephanie Desmond discusses this and more with Amesh Adalja of the Johns Hopkins Center for Health Security. Let's listen.
Amesh Adalja, thanks so much for joining me.
Thanks for having me.
I want to talk today about masks. So a lot of us have been wearing cloth masks since soon after the pandemic began. And recently I was reminded that they're supposed to be a stopgap measure because of supply chain problems. And maybe we should be wearing better masks. So what should we be wearing?
Right now, it really depends upon the setting and people's risk tolerance because many people now are fully vaccinated, and that's going to give them a lot of protection, the best protection that they can have. So that means that for fully vaccinated people, there are certain limited situations where you might need to wear a mask, and that's going to be based on your risk factors for severe disease and how likely the exposure risk is in a given area. So maybe if you're in a high-risk indoor setting and you're somebody that wants to avoid a breakthrough at all costs, you would think about wearing a mask. And in general, what I recommend people wear, because they're in plentiful supply now, are the hospital-style masks that loop around your ears that you see doctors and nurses wearing in the hospital. I think those are the best types to get now because they're available. We know that they work well. We know that they're in plentiful supply. And I think that that's probably the best type to wear in those situations when you're out in public. There are other masks, cloth masks that you can still wear that are still effective. It's just that they have to be washed and they're reused, whereas those disposable masks you can use on a day and then throw them out. So I think that increases the convenience and ensures that you're wearing an effective mask when you need to be versus cloth masks, which there is some variation in terms of their structure, in terms of their protection, in terms of their durability.
So if I'm vaccinated and I'm wearing a mask in the grocery store, are you saying that might be overkill?
I do think that a fully vaccinated individual has marginal benefit from wearing a mask because you have to remember that COVID-19 is a respiratory virus that is not going to be eradicated. It's not going to be eliminated. It's going to be with us forever. And our goal has always been to remove its ability to cause serious disease. So when you think about what happens to a fully vaccinated individual, and I'm talking about a healthy person here, their breakthrough infection is likely not to be clinically significant, not likely to require even a visit to the doctor. And I think that with a virus like this, it's going to be very difficult to chase these mild infections. So to me, I think that a fully vaccinated person wearing a mask really provides very marginal benefit. And I think it's really something that people should think about in terms of their own risk tolerance. If they want to avoid a breakthrough infection or minimize the risk at all costs, I think that they might want to wear a mask. But for others, it may not be that beneficial. Obviously, if you're in a private setting where the owner of a private property or a private venue requires you to wear a mask, you should follow those requirements because you don't have a right to enter someone's premises without following their rules. But in general, I think that there's less value in terms of fully vaccinated people wearing masks than, for example, unvaccinated people wearing masks or unvaccinated people getting vaccinated. So this is just kind of where we are in the pandemic as a whole. And I think it really reflects the fact that the vaccine does a really great job at removing the ability of this virus to cause serious disease, which is what all of this was about from the beginning. Because if you remember back what flattening the curve was about, it was about preserving hospital capacity. And the vaccines do preserve hospital capacity. It's just that not enough people got them. So we still have to rely on masks as an alternative until more people are vaccinated or become immune.
So I went on to Amazon the other day to see about getting some more surgical masks, and the choices were endless. And I have no idea if they're any good. How do you buy masks?
You basically have to look and see which are the style that are used by doctors, nurses, and hospitals. And most of those that you're going to find on Amazon probably meet that criteria. And they're all disposable, so you're only wearing them for short periods of time. And that, I think, allows you to have some wiggle room in terms of what type of mask that you're buying, because they're not meant to be durable. They're not meant to last forever. They're meant to be used basically for a day or so. So I think any of the type you see on Amazon that are in that style of a procedure mask or a surgical mask are adequate for the task that we have. And I think that it can be confusing, but you can also kind of look and see which ones have, there may be some descriptions there that some of these might be the same that are used in hospitals. Some of them might be FDA approved for hospital use because the FDA does regulate some of those as medical devices. But it is difficult. And I think that speaks to some of the issues that were raised in the report that my colleagues and I recently published, where because there's not really great standardization and there's not really great information to the general public, it is confusing if you're not a medical professional to know what each type of mask does, which ones are necessary, which ones are overkill.
So I guess one more question before I move on to the report is, I have been on a plane recently and I wore an N95. Does that make the most sense in a situation like that?
A lot of this is going to be dependent upon a person's risk tolerance. I was just on a plane. I'm a fully vaccinated individual. I did not wear an N95, even though I have plentiful supplies of N95s because I work in a hospital. So I think for N95 masks, I think for the general public, there's a couple of things to remember. First of all, N95 masks have to be fit tested. They have to actually fit on your face. They're not one size fits all. So if someone in the public supposedly buys an N95 mask and it doesn't fit their face, maybe it's too big, it might be less effective than a cloth mask because it doesn't actually fit on their face properly. So it's important to remember that about N95s. And while there has been reports of airborne transmission in certain situations, what we find is often that regular surgical masks work well outside of those settings. So I don't necessarily think everybody needs to have an N95. This is something that's controversial, and I think something that there is some debate about how efficiently the virus spreads through the airborne route and how effective an N95 is versus a surgical mask. I can tell you from my own experience, I don't wear an N95 mask except for when there's something going on in a hospital setting where I'm more worried about airborne transmission, like somebody on BiPAP, for example, which is a special type of breathing machine, or somebody getting a drug aerosol treatment. However, some hospitals have N95s for every patient. So it all depends on the scenario. But there is a lot of misconceptions, which again speaks to the fact that we've not really done a great job with masks and understanding which masks are appropriate for the general public and which masks are not.
So the new report from the Johns Hopkins Center for Health Security, please tell us a little bit about that.
Well, the report comes from sort of the gaps that we saw in terms of understanding how effective masks could be as a pandemic preparedness tool and where we wanted to see the technology and the use of masks go, not just for COVID-19. That was kind of the impetus to think about this as a medical countermeasure, but much more with protecting us against the next infectious disease emergency we face, because it takes a while for vaccines. It takes a while for antivirals to be out there. So one of the blunt tools that we can use are masks, but masks are not all the same and they need to actually work. They actually need to be something that people want to use. And it's something that I think really we have to have enough supplies on hand pre-pandemic or pre-infectious disease emergency to be able to actually to deploy the best masks for the general public. And I think we didn't do that during COVID-19, but I think we have to take the lessons of COVID-19 and apply them to the next threat or apply them to the whole job of pandemic preparedness. So this report really kind of surveys the state of the art in the field and offers some recommendations for how to think about masks and use them more optimally for the next time that this type of an event arises. And it's not a question of if this next event will arise, it's when it arises.
And this also talks about the developing of new masks, so new products. What kind of innovations do you want to see?
The thing about masks is people don't want to wear them because they obstruct their breathing, they're uncomfortable, they get dirty, they itch your face, and that decreases compliance. You want masks to be made with materials or made in such a way that they're easy to wear, that they don't interfere so much with your activities of daily living, that they're not cumbersome. And you also, at the same time, want them to be as effective as possible. And sometimes that those two things can kind of be opposing each other. So if something is very comfortable, it might not actually have really great filtration capacity. But I think that in the 21st century, we've got so much new technology that there are ways to do both of those. And I think we have to actually not be satisfied with the same old masks that people wore in the 1950s and 1960s when we have such a revolution in technology. And I think if you actually incentivize people or encourage people to make better masks that are innovative, that are easy to wear, and that are highly effective, you will likely see lots of products that you couldn't even imagine spring up. And I think that we have to start to move personal protective equipment like masks, which is kind of a boring topic when it comes to pandemics, into the 21st century by looking for these types of solutions so that the next time we have a pandemic, that we don't have this kind of muddled messaging on masks, that we have availability and the mask is something that people want to wear and that they're easy to comply with and not something that people want to discard the second they can.
So you talked a little bit about that we're basically wearing the same mask we've been wearing for 50 plus years. Where did masks come from?
Well, masks have been around for a long time. And even if you look back to the Black Death in the Middle Ages, doctors wore these long beak-like masks that basically protected. They thought that would filter out any kind of noxious fumes that might come into place. But masks have been commonplace in medicine, basically in the modern era, mostly from the operating room when sterility in operations was something that people emphasized in terms of making sure that everybody was gowned and gloved and masked when they were operating on people. But then when people started to understand the transmission of infectious diseases, you started to see more masks being used. So even during the 1918 pandemic, there were requirements in certain cities for masks to be worn. So this has been something that's been around for some time once people understood that breathing, coughing, laughing, spitting could spread infections. Just prior to the pandemic, it was the 100-year anniversary of the 1918 flu. And in Philadelphia at the Mutter Museum, they had a big display and there were these big signs there that said, "Spit spreads death," which showed that in 1918, people understood that the people's respiratory secretions, their saliva, could spread infections. And indeed, most of the anti-spitting ordinances you see in municipalities, which aren't really enforced anymore, were because people realized that spit could spread infectious diseases. And so there was this understanding that blocking that or providing a barrier would be beneficial. It's just that it's very hard to get the general public to comply with masks. Even in 1918, there were anti-mask weeks.
One of the big issues, as we touched on in this case, has been supply chain. What does your report say about how we can improve supply chain for the future?
Well, what we have to do is diversify suppliers. You can't just have one supplier that supplies these masks, and it's multiple types of masks, N95 surgical, whatever it might be, because there needs to be redundancy. You have to kind of think of it almost in a national security way, that you want to make sure that you always have a supply. And part of the solution is stockpiling, but that can't be the only thing that you do, because stockpiling may become something that's cost prohibitive. It's going to be something that needs to be replenished as these things have expiry dates. So that's not the only solution. You've got to be able to have supply chains that can surge their ability to make masks very quickly when they're needed. So it really is going to be a wholesale reconfiguring of how this process is done. And we do this for other types of raw materials that are essential for national security. And I think that type of paradigm would apply to masks as well. I mean, we do have to have a stockpile as well, and that stockpile needs to be up to date. It needs to be replenished, but it's going to be part of the solution. And we can't have what happened after the 2009 H1N1 pandemic, when the N95s in the Strategic National Stockpile were just never replenished. Everyone knew they needed to be replenished, but it just was not done. That type of thinking really has to be jettisoned and be something of the past if we're going to be resilient to the next threat we face.
Amish Adalja, thanks so much for joining me.
Thanks for having me.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holes Fernandez and Caroline Wong. Thank you for listening.